We're going to talk about your heart. You know, it's one of the busiest organs in the body, the most important, and of course, well, we need it to survive. Plain and simple. Let's just break it down to the bare minimum here. So some important information we're going to share with you on Focus this week. I hope you will take note, pay attention, and just take advantage of some valuable services we're going to talk about this morning. Our guest is Dave Graber, the COO of Daviess Community Hospital, and Dr. Ethan Oates, an interventional cardiologist. And Dave, I want to start with you. Basically, we've got a great person we're going to introduce here, a new cardiologist that is serving our community and doing a great job at that. But how did this all come about? You kind of looked for community needs. You're always looking to fill voids in the community, and this is one that you certainly saw develop here in Daviess County.
That's correct, Dwayne. Dr. Oates and I were talking a few weeks ago, and just in discussions about the high volume of aortic aneurysms that we are seeing in the local community, and we were trying to brainstorm what we could do from DCH to identify these abnormalities and help these folks get the care that they need. And just to give you some background on that is that, you know, the folks in our local community, I've had numerous relatives and friends that have been identified with aortic aneurysms that required surgical repair, and just how that affects people of all ages. I've seen folks from the ages of 20 all the way up to end of life that require surgical intervention with this. And so in discussions with Dr. Oates, we identified a test, a screening that it's called a limited echocardiogram, and it allows someone to get an ultrasound of a specific portion of their heart and can identify folks that are at a high risk. So you could have a negative finding, meaning your heart is normal, or you could be identified in any stage of an aortic aneurysm. And that's where Dr. Oates and his team can read that limited echocardiogram and can get you on the path to treatment and possible surgical repair. And I'll just turn it over to Dr. Oates and let him introduce himself and give you some more specific details.
Man, you're saving lives. I mean, you're absolutely saving lives. Dr. Oates, welcome. It's nice to meet you. I've heard good things about you. I can certainly tell you know your stuff. An interventional cardiologist. I want to start with that. What exactly is an interventional cardiologist?
Yeah, thanks for having me, Dwayne. An interventional cardiologist is basically a fancy term for a type of cardiologist that doesn't just treat with medications and testing, but actually does some degree of invasive procedures, whether it's heart catheterization, stent placement. Some of us are doing valve replacements and other things like that. Things that used to require open heart surgery, we're now doing in a more minimally invasive way.
Man, you've seen the technology and the advancements. It's crazy, isn't it?
Yes, absolutely. It's come a long way.
Even since you first started school to now, you're probably constantly learning, too.
Absolutely, yes. And the procedures that we're talking about have become available to folks that otherwise wouldn't have been offered treatment just a few years ago because they were deemed too sick. We're now doing really aggressive procedures even in folks late into their life and giving them a few more good years and improvement in their symptoms, things like that.
So many paths you can take in the medical field. What drove you to cardiology itself?
Yeah, I think it was the variety of what we got to see in terms of different diseases, different ways that we could help patients, the amount of procedures that we can offer them, but yet we've got medications that work really well. I mean, we are doing things that really give folks good quality of life and nice long life now that they're surviving other illnesses that used to take their lives, like cancers and things that they're surviving. And we're really keeping patients active well beyond what they used to be able to.
Good heart health. I mean, what are some things? There's some common things we can do for good heart health. Can you give us just some examples?
Yeah, diet and exercise does go a long way. We talk about the Mediterranean diet, for example, being a good diet to stick to, trying to stay active. It doesn't have to be high intensity type of activity, but really trying to get shooting for easily 3, if not 5 days a week of moderate activity. But really, what we're trying to make people aware of with our different screening tests that we offer is that sometimes this stuff is out of your hands, and sometimes it's a genetic issue and things that you can't control, and that's where they need to seek out ways that we in the medical community can help them identify things that may be going on, even if they're otherwise feeling okay.
So you can be doing all this. You can be the most healthiest person out there and still have an issue with your heart.
Absolutely. Sometimes things are going on beneath the surface that you may not feel. You may not have chest pain or trouble breathing and things like that, but that doesn't mean that this process of either plaque buildup or aneurysm development isn't already happening. There's sometimes that, if you're feeling a symptom, then it may be well into the disease process when we could have caught things earlier on.
And I think we got to stop right here. We're not doing this program today to scare people by any stretch of the imagination. We're doing this because people need to know this is something that is so simple, so easy to do, and it will, if nothing else, give you peace of mind.
Absolutely.
If you've got heart issues in your family, number one, you should always be aware of that and always be extra careful with the ticker, right?
Yes, absolutely. Family history really sometimes trumps all the other risk factors. We know that high blood pressure and high cholesterol aren't good for the heart. We know diabetes can really take a toll. Certainly smoking can, but sometimes it's just the genetics that are the overwhelming driving force in bringing about some of these disease processes, despite good lifestyle choices that people may make.
I hear so much about the widowmaker, and we're going to get back. I promise we're going to steer this back, but this is informative for me too. The widowmaker, it has ended so many lives. What exactly is that widowmaker that we hear so much about?
Yeah, good question. So in general, there's 3 coronary arteries that most folks have. There's usually 1 on the right and 2 on the left. Those coronary arteries start on the outside of the heart and give the heart its own blood supply and oxygen, and they go down into the heart itself, and they branch off and make sure every part of the heart is getting good blood flow. Now, certain arteries may be bigger in some folks than others, but essentially everybody, that widowmaker, or what we call the LAD, left anterior descending artery, is the most important artery for folks because it goes to the main pumping chamber of the heart. And if that artery goes down, it can really be devastating. It can cause fatal heart rhythms. It can send people into shock where the heart's not pumping well at all. Some people survive that, but nowadays, if we're getting to people earlier on and we get them into the cath lab when I'm doing my procedures, we can balloon that artery open, get rid of the blockage, and leave a stent behind to make sure that process is taken care of. And so we've come a really long way in awareness, and people are presenting earlier, and they're getting right to our cath labs to get that artery open quickly, to where now vast majority of people are surviving their heart attacks and things like that.
As we're doing this program, people are listening right now, and I'm just spitballing numbers here. I don't know. But I bet we would be amazed how many people are listening with some sort of stent in their heart as we speak this morning.
Absolutely. Yes.
Isn't that crazy?
It is. And people are having more and more of those procedures done, and they're, like I said, living longer to where they're avoiding that big, massive heart attack, which used to be how most people would present.
And as we've advanced with medicine, we've come so far. I guess the point we want to make is there is no reason for you not to get checked out, to go and get these screenings, because the medicine is there, the technology is advancing every day, and these stents, you do them like it's just part of everyday life for you now, pretty much.
Absolutely, yeah. It's a pretty slick procedure. In the old days, it used to be done through a big stick in your femoral artery down in the groin, and people were having lots of bleeding issues and things like that afterwards. Nowadays, it's pretty slick, and a lot of times we're just going through a little tiny poke in your wrist. Bed rest is only 2 hours after the procedure.
Wow.
Minimal recovery, and yeah, sometimes we're doing 10 or 12 of these a day.
It's crazy. Yeah. Dr. Ethan Oates is the interventional cardiologist now working at Daviess Community Hospital. Let's get to our topic we really want to cover. It's limited echocardiograms. I guess first I want to talk about the difference. What is the difference between a limited echo and a full-fledged echo?
Good question. So a full-fledged echocardiogram is a very in-depth ultrasound study of the heart itself. It looks at every chamber of the heart, every valve at the heart, using lots of kind of high-tech technology to tell me essentially everything I need to know about a heart's pumping function and things like that. A limited echo, what we're offering for this aneurysm screening is just pinpointing the high-risk features of someone who may have an aneurysm or be prone to developing an aneurysm in the future. For instance, instead of looking at 80 to 100 pictures on a full formal echocardiogram, this limited echocardiogram, I may only have 10 to 15 pictures I need to look at to tell me, okay, is the heart weak? Is there a valve problem that is either associated with a current aneurysm or may make people more prone to developing an aneurysm in the future? And then lastly, it's looking at different segments of the aorta itself where these aneurysms occur and could eventually rupture.
So this is non-invasive, right?
Correct. Simple ultrasound, just like people are used to seeing with a pregnant lady's belly. It's just a little cold jelly on the chest, a couple pictures, and really the test takes about 5 minutes or less.
No kidding. Unbelievable. But with that 5 minutes, you can literally see everything. And then, if everything's clear, you high five and they're on their way.
Absolutely, yeah.
And that's the ultimate goal, we hope, right?
Absolutely, and that's what we've seen already as we've unrolled this is a lot of these people are getting good news, and we'll talk to them in free consultation afterwards about if they need to be screened again in the future, whether 3 years, 5 years, or somewhere down the road. Because usually people are doing this if there is a strong history in their family where these things develop. So just because it's all good today doesn't mean it's going to stay that way. But the hope is that we find mostly normal studies. But we've already seen a few folks who had no symptoms who are catching aneurysms that are nearing the point of needing surgical repair before something bad could happen.
Well, and when we talk about aneurysms, we're finding that this is more and more prevalent in our local community. That's where the need arose for this, right?
Absolutely, yes. The local community has a high prevalence of these aneurysms, meaning we're seeing a lot more of them than we do in the general community elsewhere. And we're also seeing that these aneurysms become a problem much earlier on in the process than in a lot of other communities. We've got very good guidelines where we know when someone needs a surgery to replace these in the general population, but in the local community here, we're seeing those aneurysms really be at risk of rupture and really bad outcomes at an earlier stage to where we're having to, do more intervention earlier on than we normally would.
Are there any signs?
Usually, if you're having a sign or a symptom, it could be too late, or we could be needing to do a procedure emergently when if it's caught before there are symptoms, then it can be done in a very well planned out fashion where you get a lot better surgical outcomes and recovery from that.
So the limited echoes are available now, limited echoes. The price, Doc, I can't believe this, $300. That's an unbelievable offer.
Absolutely, yeah. We were seeing before this, the only option for the community was to pay probably at least quadruple that amount, and a lot of times that's an out-of-pocket expense. So we wanted to make something that could be accessible to everybody and make sure that cost wasn't something keeping folks from getting, potentially life-saving care.
And when we say aneurysm, these are they can lead ultimately to death.
Absolutely.
In the blink of an eye, right?
Absolutely. We're talking specifically about the aorta itself, the most, arguably the most important artery in the entire body. It's what takes blood flow from the heart and distributes it out to the rest of the body. And so that sees a high pressure of blood flow every heartbeat. And if that gets to the point that the walls of the artery weaken and ruptures, it's usually fatal very, very quickly. And that's why we're focusing on catching it early.
You've got to. And you hear a lot of stories of people dying from aneurysms as well, that if they could have just detected it, it could have been prevented. We want to stress, though, the limited echoes, $300. Take advantage of this now. Get your appointment. See Dr. Oates. Certainly knows his stuff. But this is not to take the place of your annual visit with your cardiologist. You said that, but I want to stress that again, right?
Yes, absolutely. This test is primarily geared towards first-time people who did not have any identified history of aneurysm, but know that it's in their family and they want to make sure that they're not affected.
Can your daily routines cause possible ruptures depending on what you do?
There's really one main activity that we want to stress to folks to avoid if they have an aneurysm identified, and that's heavy lifting. And I know that's very common, whether in people's jobs or their hobbies or things like that, but that heavy lifting really transmits a lot of that pressure directly to that aneurysm, and that's where that can lead to widening and eventually rupture. And so if we find that, that's the main thing we counsel people against, is avoid heavy lifting. Yes, we're going to control their blood pressure. Yes, we don't want them to smoke, obviously, but that heavy lifting is the single best thing that they can avoid to avoid bad outcomes.
So we talked about most are seeing positive outcomes from this, which is great. That's ultimately what we want you to see. And it's $300 well spent, man, for peace of mind, if nothing else. I mean, I can only imagine the gasp of fresh air that people are breathing after they find they're okay.
Absolutely. And the neat thing that we're seeing, too, is this is so prevalent in families, and it's happening at really young ages in the local community. So you see the reassurance that the patients are getting when they don't have one. But more importantly, I'm seeing a lot of parents who have had their kids screened in early adulthood, and the relief that they feel from knowing that their kids are okay is really been the most rewarding part for us.
Now, on the flip side of that, if the limited does show something, where do they go then from there?
Absolutely. So certainly we're glad to see them here in the cardiology community, in the cardiology clinic at Daviess Community. Once we see them, we quickly are getting them further testing, more detailed pictures with things like CAT scans. And once we get that information on exactly how much of the aorta is involved and how dilated is it, that's what tells us, okay, how quickly do we need to act? Is this something where we can sit by and monitor every 6 months for a while, or is this something that we need to jump into action and get you evaluated by a surgeon or someone who would need to do an operative repair of that?
So again, just take this time, do it, take advantage of these limited echocardiograms because it could mean literally the rest of your life. If aneurysms run in your family, if you have a family history of it, again, it's more and more prevalent in our local community. We're finding it. That's why DCH has stepped up to offer these, which I think is a great service because a lot of facilities are not offering the limited, right?
Correct. Yes, or not offering certainly at a discounted rate like this where it's readily available to everybody.
$300. So definitely take advantage of it. What are some other general heart health issues that you see are becoming issues? Are there any others that we can focus on this morning?
A good topic is another test that we offer that's meant to be a screening test, and it's only $49. It's what we call a calcium score test. That calcium has nothing to do with the calcium that you eat or that you drink. It's about detecting calcium buildup or plaque buildup in those coronary arteries. You'd mentioned the widowmaker artery earlier. This test is a one-time-in-your-life test for most folks. It only takes 15 minutes, and that allows our radiologists to detect every little speck of plaque that may be building up in your arteries that may lead to a heart attack in the future. And that's been a incredibly valuable tool. Again, that's catching people who may have severe heart disease but have no symptoms.
Can't stress enough, you guys got to come see this guy. Dr. Ethan Oates, available cardiologist, interventional cardiologist at Daviess Community Hospital, knows his stuff. This has been an educational process for me too this morning, Doctor. I really appreciate you being with us this week. If folks are listening and they're ready for these limited echoes, I hope you want to get there as soon as we wrap up this broadcast this morning. Make the call, get the job done. Where are you located, and how can they get a hold of you?
Yeah, thanks for asking. We are on the second floor of DCH there in the specialty clinic. If people are interested in these limited echoes, the number that they should call is 812-254-9324. Again, that's 812-254-9324. And then we're always happy to see them in the cardiology clinic there. We can be reached at 812-254-2834 for appointments. And we're seeing a lot of people that we're getting in same day. And again, that's 812-254-2834 for the cardiology clinic.
$300 for the rest of your life. Make that investment. Get the limited echoes today. Dr. Ethan Oates will take good care of you and get the job done. He's got a full staff there in the cardiology department. Great information this morning, Doctor. Thank you so much. And Dave will just put the wraps on this by saying, what a guy you found here in Dr. Oates, huh? I mean, what a joy it is to have him in our community at Daviess Community Hospital.
He's definitely a high performer. He takes excellent care of his patients. He's a great communicator. He's very knowledgeable, and he sees, so many of these folks. We have to be urgent in our care for these types of conditions, and he does a great job.
Stepping up. That's what DCH is doing. Again, filling the need, filling those voids, and certainly answering the call for our local community. $300, limited echocardiograms. The phone number, once again, to schedule is 812-254-9324. Take advantage. Please don't let this be the end of your life. It's something that can be detected and taken care of, especially if aneurysms run into your family. These are certainly worth a little bit of your time. Non-invasive, simple 5-10 minutes. You're probably out within 30 minutes with the reading and everything, and you will be on your way. Guys, thank you so much. Really appreciate the time on Focus on the Community this week. Great information. We appreciate you being with us.
Thanks for having us.